to the Eastern Cape we go. I want to bring in now our reporter Busisiwe Jemsana-Mantashe. There, she's covering the story for us with regards to the effects of COVID-19 in the Eastern Cape. Remember, Eastern Cape registered its first confirmed case of COVID-19. Busi, a very good morning to you. What's the latest there on the ground?
A very good morning, Blaine. Indeed, yesterday the province recorded its first case of COVID-19 and people are panicking, but officials and authorities are urging that people remain calm and exercise those cautionary measures that are put up. We did tour around yesterday from clubs, pubs to see if those retailers are adhering to those measures, the 1 o'clock measure, and many of them were closed. People, though, still drinking outside those outlets, something that has been criticized, as the president and the minister said, strictly no drinking in public areas. But Blaine, this morning we wake up to reports that there is another confirmed case of a tourist that was traveling from Germany, and as a result a lodge here in East London has been closed following those reports. But let me bring in the MEC for Health, Cindy Swagomba. MEC, thank you so much for your time. Can you confirm that indeed there is a confirmed case of a tourist that is here in East London, and talk to us about the details surrounding that?
Yes, it is true, Busi. What we gathered is that we have got tourists that actually left Germany and are touring. As to whether they got off in Johannesburg, in OR Tambo, or Shag International Airport, we're not sure. But what we know is that they traveled KwaZulu-Natal and they happen to be in Pietermaritzburg. We are informed that the patient...
It seems that we have some issues with regards to the sound there from East London. Busisiwe Jemsana-Mantashe, they're talking to us about the latest on the ground. Remember, the Eastern Cape has registered its first confirmed case of COVID-19. And we'll try to get Busi back in terms of, what sort of panic. She was talking about panic in the Eastern Cape. And, is it purely because they registered the first case, or is fake news contributing to the panic, the anxiety, the uncertainty that is prevailing, I guess, not only here in South Africa, but in many parts of the world? I understand we got Busi back on the line. Busisiwe Jemsana-Mantashe, you're back with us. Yeah, sorry, you just broke up there when you're talking to the MEC. Just recap for us, what's the latest on the ground?
All right, well, the MEC, Blaine, was still telling us that there is a confirmed case of a tourist that was traveling from Germany. Details as to whether he got off from the plane in OR Tambo or KwaZulu-Natal are still very sketchy, but they know that there was a stop in Pietermaritzburg, and the tourist actually complained about some symptoms when he or she was there, but they do not know how then he or she was let off from Pietermaritzburg. MEC, you were still saying that this baffles you, that there would be tourists that are let off without the proper cautionary measures.
Yes. We are informed that the tests were done in Pietermaritzburg, but what we do not understand is whether there was some laxity in terms of realizing the 48-hour wait, that the tourist was then left off to continue the tour, and they landed in Krinza, and only when he was already here in Krinza, the results came to say they are confirmed the patient is positive. What we have done now as the province is to actually quarantine the area. We've sent some police, so the area is cordoned off. Nobody's allowed to get out, nobody's allowed to get in, for fear of contamination of even workers. Though we understand that the owner of the area, of the facility itself, has actually laid off the workers to say today they mustn't come into work. We are still concerned, would want to actually test those workers, because the very issue that we are talking about COVID-19 speaks to conducts. What if they have contacted the very particular patient? So for us, it's still an issue. So our medical team is getting to the area. The police are already there. So what is now going to happen? To immediately screen those that are there, but will quarantine the area. So in a sense, the trip is stopped.
Are you tracing the workers, or are you asking them to come forward?
One of the things is that if this tourist was a person who was able to tell us who he has come to contact with, it's easy. But on the basis that he gets served. So it is important that all workers of the institution that have been during this period, that those tourists have been there, come forward and they actually get through screening.
And you're saying this is an abnormal situation where the patient was let off and then results came in later after he had traveled from KZN to the Eastern Cape. Under normal circumstances, do tourists wait for that 48 hours or do they get quarantined for that 14-day period for the country or the province to be sure that they are safe?
Well, see, it is irrespective whether a person is a tourist or not a tourist, whether stays in the area or doesn't stay in the area. If a person takes a test and is symptomatic of whatever in terms of COVID-19, that person must be able to be isolated. And that person must be isolated waiting for those results. But this is where I'm saying we are finding it strange that the tourist was let off to travel. Remember, their itinerary, were informed, was that from Trinsa they're going to Tsitsikama. Tsitsikama is still in the Eastern Cape, and we're worried what's going to happen when they get to Tsitsikama. We might not be having one when we get to Tsitsikama. We might be having many, depending on how fast they actually are going together as a group, equally not even observing the distances, because they are in a bus. We're told they're 35. This morning we're told it is a combi or a car that has got Cape Town registration. It has got 11 people. So we're trying to dissect the two information, whether we're talking about the same group, whether it is coming into two transports, or we're talking about two groups, but one patient is common in all the story.
With the travel bans, MEC, and tourists coming in and out, are we still allowing tourists to tour or people to tour the province in this state of situation that we find ourselves in?
Myself and the Premier this morning, we spoke exactly on the issue that maybe what would actually assist in this predicament would be a total lockdown of tourists, up to a point where it suggests that whoever is outside the boundaries of the Eastern Cape must not be allowed to come in. Because I would not understand at this point in time that people will still understand that there's COVID-19, still stay where they are. And at this point, we're getting a lot of people who are now panicking that we've got a confirmed case in the Eastern Cape. But our case as the Eastern Cape solely is still one, because much as the results are here, we're not claiming that this is a person from the Eastern Cape. It's a tourist from Germany en route in the Eastern Cape.
You also have farmers that landed in the province yesterday. MEC, they were also from Germany. Talk to us about that.
Okay. We have got a team of 15 small, young farmers that went out to Germany to study and be sharpened in skills in their field of operation. The 10 came back, but this group of 5 were informed that because they had challenges with visas, they then left after the other group and they were then behind. So that group actually came back home and they landed in East London. When they landed in East London, we took them as a group. We had already organized a quarantine area. We've put them in a quarantine area here in East London. We believe they are safe. We are observing them. We are doing our tests to actually ensure that nothing has happened. However, we are quarantining them for the full 14 days so that we actually beat the incubation. We are sure that nothing has happened. So we'll only release them after 14 days, after we are confirmed and we're satisfied that there's nothing. They have not contaminated COVID-19.
Lastly, MEC, can you confirm that there are tests taking place in the East London airport, because there were reports that no tests are being taken as people land, or are the tests taken specifically to those who are saying from overseas, or is everyone subjected to those tests?
There is a particular protocol that we follow, Busi, in terms of understanding what then and where people have travelled to. For some reason, remember, this is a flu season. It is possible that people have got normal flu, but because there is coronavirus, they would panic. So when we deal with those specific cases, we actually ask specific questions like whether, when were you, have you ever been out of the country, when did you come back, whatever. And we link the symptoms, because symptoms are not the same. We link the symptoms of what we see and what happens. In airports in East London, we are not testing, but just screening. So that we take temperatures, and once temperatures are up, then we start to think something must be done with this one. Then we go for specific tests. But if we are there and people, as they say, I have flu, we look at the symptoms and the history, and we start to say, this one is not a candidate for testing, this is normal flu.
But in all that, officials, authorities, medical practitioners can have their hands on the deck, but it boils down to individuals. It boils down to each citizen that they must exercise those cautionary measures that have been put out.
That is why we're urging our people. There's this paranoia about wearing masks. We're saying, yes, it is fine for people who already have flu to wear masks, because their immune system is a bit challenged at the time. But equally, they must not be able to spread their own flu to other people, because we don't know what strain of flu they are actually having. The second one is saying, as we are dealing with that, we are encouraging our people to observe hygiene directives. One of the most easiest things to do is to continuously and periodically wash your hands thoroughly. Not this wash of opening a tap and leave, but a thorough 20-second kind of wash, which we are actually displaying in some videos in the Eastern Cape to say, how do we wash our hands so that we can be sure? At the same time, we're saying, can we find spaces where our people, as they enter those spaces, there are sprays that they spray on. Because one of the things why we're saying people must always wash their hands is that you wash hands, you believe they are clean, but you still touch surfaces, and your hands therefore are contaminated. So if we keep on those things, the second one is, even if we're sneezing, even if we're coughing, can we make it within a distance of 1.5 to 2 meters, so that all the time we keep the distance? I know what I'm saying is not the usual things. We are not used to that kind of character. We are loving people who are close people, but can we observe those things? They're not going to last for a long time until we're able to isolate COVID-19 and treat it, because the way we are doing, we are actually quarantining our people, ensuring that they are not at all mixed with others.
MEC, thank you so much for your time. MEC Cindy Swagomba, they're talking about those directives and hygiene measures that people must take, and also people have been urged, Blaine, that as they go into funerals, that they try and limit the number, and this is for the safety of all the people, the mourners and people that are in those funerals. And also, as we heard, the Premier has issued a directive that the initiation season has been suspended, because there is a concern, Blaine, that now that schools have closed, there are those who have already started taking boys to initiation schools. The province strongly cautions against that, as these young boys can be at risk of contracting the virus. And so as things stand, initiation schools in the Eastern Cape have been suspended, and those who do not adhere to those directives might face criminal charges and some punishment from authorities and the government. As you heard, Blaine, a case of a tourist that has tested positive in the Eastern Cape. They were traveling from Germany. The place has been quarantined and they are on lockdown. The province is trying to trace the workers of the lodge that have been asked not to come into work, so as to test them and try and contain the spread of the virus. Also, importantly, the MEC is saying that they are in talks with the Premier to try and see extra measures that can be implemented in terms of locking down the province for a couple of days, so as to try and manage the spread of this disease. Again, Blaine, cannot reiterate and emphasize enough that people need to take those extra caution, those measures of washing their hands regularly with soap, and those of keeping the social distance wherever they are, be it funerals, be it in queues, be it in social gatherings. That distance is the reality, and that the virus is a reality. And so if people exercise those and take those measures into consideration and actually implement and live by them, then the province stands, in the country at large, actually, Blaine, stands a very high chance of winning against this virus. Blaine.
Yeah, it's the common sense hygiene protocols, isn't it? Important information coming out there from the MEC, important advice and fresh information with regards to possible a new case there of confirmed case of COVID-19. Contact tracing would be key here. Busi, we appreciate your reporting. Busisiwe Jemsana-Mantashe live for us in East London, Eastern Cape. Well,